Good day everyone, and welcome back to my YouTube channel. If you are new here, I'm Mr. Managwing and I discuss everything health. To my returning subscribers and viewers, this is me saying thank you for sticking around. In today's video, I'll be talking about premature ejaculation. So what is premature ejaculation? In a layman's understanding, this is when a man ejaculates sooner than expected, that sooner than him or his partner expects, okay? Then it is also defined by the international guideline as ejaculating within 1 minute of penetrating your partner, hence the name 1 minute man. This can be very frustrating and it makes your sexual life unenjoyable, and premature ejaculation, PE in short, is said to be the most commonest sexual dysfunction in men. So having known what premature ejaculation is, we'll move over to the possible cause of this. For the sake of simplicity, I'll be dividing them into subheadings. So you have the physical cause, you have the psychological causes, and you have the chemical causes. Okay, so for the physical causes, we have erectile dysfunction. I've done a video on erectile dysfunction. I'll drop the link in the description box so you can just go through that. Okay, then for the psychological factors, you have stress, you have depression, you have performance anxiety. This performance anxiety can be due to lack of confidence in carrying out sexual activities, or if you've had abstinence from sex for a very long time, that can lead to performance anxiety. Then the last but not the least is relationship issues. So if you have relationship issues, it can affect your performance. Okay, next is the chemical factor, where there is an imbalance between the serotonin and the dopamine level. These are neurotransmitters in the body. High level of serotonin leads to delayed ejaculation, and the reverse for dopamine is the case. But in this sense, when the serotonin is low, you tend to ejaculate faster than normal. Okay, so having known the causes, let's move over to the treatment regime for this. For the treatment, we have the behavioral therapy, we have the counseling, and the use of medication. I'll be starting with the counseling. Okay, so for the counseling, what it entails is you seeing a psychotherapist, which your urologist can give you a referral to. Okay, and mainly people that benefit from this counseling, if your cause of premature ejaculation is as a result of psychological factors like depression, performance anxiety, etc., then you definitely will benefit from counseling. The next one is behavioral therapy. What does this entail? So this behavioral therapy entails practicing techniques that will help delay ejaculation or help you delay reaching orgasm. That's the peak of sexual arousal. So we have one, pause and squeeze method. Secondly, we have the start and stop technique. Then the last but not least is the distracted thinking. Okay, so what does the pause and squeeze technique entails? For the pause and squeeze technique, literally what you just have to do is, when you stimulate your penis, okay, you have to stimulate it till it gets to the point where you feel like you're reaching the peak of the excitement. Just before orgasm, you stop, then you squeeze the head of your penis, or your partner does that for you for some seconds till the urge dies off. Then you need to repeat this for some time. Okay, then the next one is the start stop technique, which is similar to the other one, but the difference now is you don't have to squeeze the head. You just literally need to just stop the activity till the urge dies off. Okay, So what this particular technique does is it makes you to be aware of the various stages of orgasm. I will drop a link on a video I made on orgasm and sexual arousal stage, so you'll be aware of what happens before you get to orgasm. Okay, so this particular technique makes you aware of what happens before orgasm, so you can be able to control yourself. Then the last but not the least is the distracted thinking. In this distracted thinking, what you just need to do is think about something different during your sexual activity. You can think about your business, think about money, football, something abstract away from the activity you are actually carrying out. So the next one is medication, which involves use of antidepressants such as selective serotonin reuptake inhibitors. Okay, example of drugs under this is citalopram, sertraline, etc. Then the next one is use of anesthetic sprays or creams. So what they literally do is to numb your penis, but you need to read the manufacturer's instruction before applying it. But most of them you need to apply it for at least 15 to 30 minutes before carrying out the activity. Okay, so when you apply 15 to 30 minutes, you need to wash it off. Okay, then allow it to stay for like 5 minutes before insertion. Last but not the least is use of erectile dysfunction medications. You can find that in the last video I made. Okay, so thank you for watching my video. Please don't forget to click the subscribe button if you've not done that already, and turn on the notification bell to get notified on when next I post a new video. Bye bye.